So one of the things that were discussed in the live class was discussing if a goal is too specific, how difficult it may be for the learner to achieve that goal. And it's actually interesting because when I'm doing my quality assurance checks, I actually see the complete opposite. Like goals are not specific enough and not objective in nature. So I'm constantly giving feedback on how to make the goals more specific, more time-based, more relevant. But you did pose a good question because I feel like sometimes when I'm creating goals, I create them so specific, and sometimes I see learners are having a hard time reaching those goals. And I think that that is an interesting point to make. You also mentioned just the lack of progress towards goals. Or even the opposite is too much progress towards goals. So if goals are not specific enough, then the goals may be mastered out very quickly or very soon. And the question then becomes, are these goals being mastered out because the learner is actually achieving and mastering the skill? Are they being mastered out because the goal is just too easy, or are there other factors involved? And this actually happened to me in the last week or so. I had put in some goals for a new client, and within a month, he's mastering out like almost all of his goals. And I'm like, well, that can't be right because I know this goal is specific, it's measurable, and it's relevant for his skills and deficits. And when I really did IOA and a QA check with the RBTs to make sure they're implementing the treatment plan at high fidelity, I realized that fidelity was the issue. So once I modeled everything and used BST and we collected IOA and really trained them, we realized that he was not mastering these targets and that they just weren't implementing them as they were written or expected to be implemented. So I think when a learner is either making too much progress towards a goal or not making enough progress or whatever the case is, it's important to evaluate all these other factors to see what the reason is, because the goal itself may not always be the problem. It may just be implementation of the goal or those expectations that surround it. Then you guys started to talk about on-task behavior, and I really love this question because when I'm creating a goal for sustained attention, which is a pretty common goal across all my learners, no matter what their age is, obviously it's tailored to their skill level, but we have to ask the question, what does sustained attention look like for this learner, right? For some clients, it's attending to a puzzle for 30 seconds. For some, it's attending to a full workbook for 2 minutes or 5 minutes. For some, it's just looking at, sitting at the table and attending to a block structure for 5 seconds. So really making sure the goal is tailored and that expectation is tailored to the learner. But also, what does off-task behavior look like? And what amount of off-task behavior is acceptable. And I typically put in my instructional notes that if the learner gets off a task for a certain period of time, but they redirect themselves, this is still considered on task. Now, it really depends on what the task is, right? So if I have a higher functioning learner who's working on a math workbook and we want them to attend for 5 minutes, if they get on task for 15 seconds and then come back on independently, that's still an independent response because they independently came back on within that time expectation. Now, if it's a 2-year-old who's lower functioning, who we're working on attending to a block sequence for 15 seconds, going off task for a full 15 seconds will be incorrect because they're past that interval time. And for those younger learners, they're less likely, not younger specifically, but the lower functioning learners, they're less likely to get back on task independently. So I guess creating an expectation that fits the needs of the clients and is realistic, because I know that, if I'm working on a paper, I can get off tangent and go on my phone for 5 minutes, but then I can come back and finish my work and I'm still on task because I'm at that functioning level, right? But going off task for 5 minutes for a 5-year-old with autism probably wouldn't be a realistic goal or expectation. So really outlining that. And then my classmate had asked, is like a permanent product a good way to measure on-task behavior? So it could be, depending on what the goal is, right? If I have a kiddo who's supposed to attend to a puzzle for 30 seconds, it's unlikely that they're going to complete a full puzzle in 30 seconds, depending on how big the puzzle is. I'm more so concerned with them looking at it, attempting to work on it, not having behaviors, whatever the case is. So like in that instance, there may not be a permanent product because the expectation wasn't for them to complete the task. But for other, clients, I have a 15-year-old client who's in school and the expectation is that he's completing his homework within a certain period of time. So a permanent product may be appropriate in that moment. But in that case, I may not be as focused on like the time he spends completing it because I just want him to complete it without behaviors and, in general. So I guess it really just depends on what exactly you're looking at.